Hi, this is Jeevaratnam and welcome to my channel Jeevan Astro Answers. Diabetes mellitus. Commonly known as diabetes, is a metabolic disease that causes high blood glucose. Glucose comes from the Greek word for sweet. It's a type of sugar that we usually get it from foods what we eat, and our body uses it for energy. Glucose mainly comes from foods rich in carbohydrates like bread, potatoes and fruits. As we eat, food travels down to the esophagus and then reaches the stomach. Here, acids and enzymes break it down into tiny pieces. During that process, glucose is released. Then, glucose enters into the intestine where it's absorbed. From there, it passes into the bloodstream and enters into the cells. As the glucose travels through the bloodstream, it's called as blood glucose or blood sugar. Insulin is a hormone that moves glucose from the blood into the cells for energy and storage. Insulin that it regulates the level of glucose in the blood. When the blood glucose rises after we eat, the beta cells of the islets of Langerhans in the pancreas releases insulin into the bloodstream. Here, insulin acts like a key. It's just unlocking the muscles, fat and liver cells so that glucose can get inside them. Most of the cells in the body uses glucose along with amino acids and fats for energy. But glucose is the main source of fuel for the brain. Nerve cells and chemical messengers are in need of glucose as an energy source to help them process information. Without the glucose, the brain wouldn't be able to work well. After our body has used the energy it needs, then the leftover glucose is stored in little bundles called glycogen in the liver and muscles. Our body can store enough glycogen as a fuel for a day. After we haven't eaten for a few hours, the blood glucose level drops. The pancreas stops churning out insulin. Then alpha cells in the pancreas begin to produce a different hormone called glucagon. It signals the liver to break down the stored glycogen into glucose. Then the glucose travels into the bloodstream to replenish our energy supply till we eat again. The liver can also make its own glucose by using a combination of waste products, amino acids and fats. People with diabetes have higher than normal levels of glucose in their blood. A level over 200 milligrams per deciliter in 2 hours after a meal or over 125 milligrams per deciliter in a fasting condition is considered to be a high blood glucose, and this condition is known as hyperglycemia. Between meals, the blood sugar should be less than 100 milligrams per deciliter. This is called the fasting blood glucose level. The most common types of diabetes are type 1, type 2, and gestational diabetes. In type 1 diabetes, the body does not make insulin. The reason because the immune system attacks and destroys the cells in the pancreas that make insulin. Genes may also play a role in some people. It's also possible that a virus sets off the immune system attack. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. In case of type 2 diabetes, the body does not make or use insulin as well. Type 2 diabetes can develop at any age, even during childhood. Type 2 diabetes stems from a combination of genetics and lifestyle factors. Being overweight or obese increases the risk of getting diabetes. Carrying extra weight makes the cells more resistant to the effects of insulin. This condition runs in families. Family members share genes that make them more likely to get type 2 diabetes and to be overweight. Gestational diabetes develops in some women when they are pregnant. Gestational diabetes is the result of hormonal changes during pregnancy. The placenta produces hormones that make a pregnant woman's cells less sensitive to the effects of insulin. This can cause high blood sugar during pregnancy. Other types of diabetes and less common types include monogenic diabetes, cystic fibrosis related diabetes, etc. Sometimes people call diabetes a touch of sugar or borderline diabetes. These terms suggest that someone doesn't really have diabetes or has a less serious case, but every case of diabetes is serious. High blood sugar can increase the risk for heart disease, heart attack, and stroke. Kidney disease called nephropathy. Nerve damage called neuropathy. Eye disease called retinopathy. Hearing loss. Food damage such as infections and sores that don't heal. Skin conditions such as bacteria and fungal infections. Depression, dementia. And the general symptoms of diabetes include increased hunger, increased thirst, weight loss, frequent urination, blurry vision, extreme fatigue, sores that don't heal, tiredness. In addition to the general symptoms of diabetes, men with diabetes may have a decreased sex drive, erectile dysfunction, and poor muscle strength. Women with diabetes can also have symptoms such as urinary tract infections, yeast infections, and dry, itchy skin. Now we see the role of planets, signs, and houses that is responsible for diabetes. 2 or 3 malefic planets, if seated in watery signs, that is Cancer, Scorpio, and Pisces, usually cause diabetes. This is the chief planetary affliction which is solely and chiefly responsible for causing diabetes. The 6th house from the ascendant controls the kidneys. 2 or 3 malefics in the 6th house may develop diabetes. Libra has a good control over the kidneys. 2 or 3 malefics here may encourage diabetes. The Moon and Venus are watery planets. If they are afflicted by fiery planets like Mars or the Sun in the watery signs, the native may be attacked with diabetes. If the 6th Lord is seated in the 8th or the 8th Lord in the 6th, the native may develop diabetes. It involves Venus, Moon, and Jupiter. Venus, Moon, and Jupiter, or Sun, Moon, Jupiter together with affliction of Virgo Rasi, 6th or 8th house, Lord of 6th or 8th house, and it gives rise to diabetes. Over time, having too much of glucose in the blood can cause serious health problems. High level of glucose in the bloodstream can damage the vessels that carry oxygen-rich blood into the organs. It also damages the nerves, kidneys, eyes, and other organs. If you do have diabetes, it's very important to keep the blood sugar numbers in the target range. For this, you may need to check the blood sugar several times in a day. Although diabetes has no cure, you can take steps to manage the diabetes. If the blood sugar is too high, you may need to take medicine and or follow a special diet to stay healthy. Anyway, I hope you might have enjoyed this video. Thank you and meet you all soon in the next video. Bye, take care.